Hi, everyone. Thank you for joining us. Today on Ask the Experts, we have Beth Liston, Dr. Beth Liston. She did her undergrad at Notre Dame. She got her PhD and her MD from The Ohio State University and did her residency in internal medicine and pediatrics at Yale New Haven Hospital. She's been a doctor here in Columbus again for over 10 years, and she's currently the Ohio rep for District 21 since 2019. Congratulations on all of those things. Thank you, Dr. Liston, for being here with us today. I know that you've done a tremendous amount of work both as a doctor and as a legislator. I'm aware that you've been doing some heavy lifting on addressing the opioid epidemic here in Ohio, which is, until COVID, was one of the most preeminent health crises. Can you tell us a little bit about some of the work that you've been doing to address the opioid epidemic?
Yeah, absolutely. And thank you so much for having me here. I'm grateful to talk with you, and I'm excited for you to join me in the Ohio General Assembly, because there's a lot of work to do. But as far as the opioid crisis, I think everyone is aware of how much Ohio has been struggling. And from a public health perspective, I like to think about tackling that in maybe three buckets: prevention, treatment, and then harm reduction. And so as you look at ways to make an impact, I like to kind of categorize what I'm doing in those buckets. So first of all, prevention, right? For everything, every health issue, the best way to address a disease is to make sure that people don't get it. And so in this case, one of the ways that I've been able to, I think, raise the conversation is through health education standards. Ohio is actually the only state in the country that doesn't have health education standards. Now, we require health, and in fact, we require health, and it is the only required subject that doesn't have health education standards. And what this is guidelines that the state issues that show districts what skills we want students to have at the end of their educational process. So it's not prescriptive. It doesn't say you have to teach this or teach that, but it says, hey, by the end, we need students to have skills in health that will keep them healthy. And so one of the very first bills I introduced was on health education standards and trying to get that conversation going. Some districts, I think, do an amazing job with teaching about some of the risks and dangers of substance abuse, but I think others could use some guidance so that we have a standardized approach and know all kids in Ohio are getting that. I think there's a lot of different policy things on the prevention side, but for me, that health education is really key and where I've been focusing. Treatments, another big bucket. You know, there's a understanding within medical community that this, addiction is a disease, and for people who are addicted to opioids or heroin, it's not simply a matter of willing yourself out of it. There are biochemical changes in the brain that have occurred, and people really do need effective treatment. We call that medication-assisted treatment, and one of the things our state budget did was really invest in mental health and addiction services. The capital budget would have done the same. I think we had a proposal for a large center in Franklin County that did expand mental health services around here, and we've been growing those mental health and addiction services and treatments. Obviously, the budget is a little different these days related to coronavirus, so unfortunately some of that I think is going to be stymied. But I've introduced bills to improve telehealth services so that particularly for mental health providers, I think people have been growing the physical health services, doing televisits with your physician, although clearly the coronavirus epidemic has expanded that, but mental health services and counselors and the ability to do that remotely, I think, is a part of it. And there's a lot of movement to move towards drug courts and getting people more into treatment as opposed to prisons. And then finally, I know I'm talking a long time on this one question, but there's definitely movement on harm reduction. So I brought
that actually was where I was going anyway. So yeah.
Yeah. So I brought, some Narcan trainings into my district. Anyone can actually get Narcan at the pharmacy. So if you had concern or truthfully just wanted to have it available, you can go and purchase that, but that's not something most people are aware of. So we have a bill that I just voted for in the health committee that ensures that pharmacists know about this and can spread the word, so to say, so that in those concrete examples, when someone's overdosed, we can save those lives urgently and then get them into treatment and hopefully, keep the disease under control. So
well, and a lot of times people feel like this is a distant issue, but I've seen challenges with this in my students and for sure in my community. Just this year, someone right down the street from me passed away from overdose. So anything that we can do in our community to reduce the impact on our community is going to be helpful. There is a recent effort to refocus on harm reduction in the community. My understanding is that we can address some of these problems through community aid rather than policing efforts. And I've seen studies that show that free needle programs can both reduce infection and overdose problems. Are there any efforts in Ohio to move toward harm reduction instead of criminalization?
So statewide, I would say yes. And then in the legislature, that's coming in the form of more criminal justice reform, taking a look at sentencing practices and opening more drug courts so that it doesn't automatically, become a felony conviction. Definitely in the city and then statewide, there's a lot of initiatives to look at what is an appropriate approach to an individual who does come in contact with the law related to drug use or drug possession. Expanding the drug courts and decreasing penalties, I think, have been the places where we've seen movements, and we'll continue to see that in a semi-bipartisan fashion.
There are studies that show that rising unemployment rates affect the number of opioid-related deaths. Have you seen a relationship between the deteriorating economy and our social distancing efforts and overdose rates since the onset of this COVID epidemic?
I would be surprised if it didn't exist. I have not seen the numbers. I'm not entirely sure they've been parsed out that specifically, because it's been, it feels like forever that coronavirus has hit us, but we're talking about 4 months.
Yeah.
So certainly people are more isolated. Certainly there's a lot more need, and then there's a lot more stressors related to the economy and finances, and people fearing for their health, but also needing to make their rent and cover their bills. Yeah. So I think we're going to see it. It's part of the reason for even expanding telehealth services is at least we want people to be able to reach out and talk with someone and get some emotional support.
How do you think that we're doing with our efforts to reopen the economy, and is this the appropriate time to be doing that?
So I think everything we do has risks, and you have to balance the risks and the benefits. In Ohio, I agree, we acted quickly. We stopped what's now being referred to as super spreader events, where you have a lot of people in close contact and indoors where air exchanges and droplets are intense, so there's more likely for spread. And I think we were pretty amazing and on the ball with that. And now we're all, I think, across the country and across the state muddling through what is safe, how does it really spread? There's more and more information that says that it's not as much the contact, like not surfaces as much as it is really the air. Mm-hmm. And coronavirus has been smoldering is the kind of the term I call in Ohio. It's not gone away. I mean, even last week and for the several weeks prior, 400 or 500 people a day were getting sick. And, we had and somewhere between 10 and 20 deaths every day. So it's not gone away. There's no reason to think it would. The last couple of days, we've started to see numbers rise and above what the daily average has been, and I'm concerned about that. I think we need to keep taking the available data saying, hey, it is droplets, it is that air spread, and make sure we're making good decisions about that. Masks, I think, are becoming more central to the conversation, and there's a couple of good scientific studies that this seems to stop the super spreader events and makes people safer. There's obviously been some political resistance to that, which is, I am unsure about why it's become so partisan. I think we all want to help each other.
What are some appropriate actions? As people are starting to return to work, as people are starting to leave the house again?
Droplets, that's where the 3 to 6 feet come from. You want to be out of range of air droplets. And you want to be in a place where if someone has droplets coming out, it's not going to hit you. So those plastic guards or face guards, actually that's what it's for. Droplets come out, they're not hitting you. Not a lot of people are doing face masks in terms of like plastic masks, but those are, probably more effective than the cloth masks. But then the cloth masks will catch some of it, right? Not all the droplets are going to be caught, but there are fewer. And then not being in a place where there's going to be lots of droplets that are around. If you're in a crowded building where lots of people are there and it's inside, so the air isn't blowing it away, you're going to be exposed more. So yes, wear a mask, yes, wash your hands, but really be aware of the environment around you, especially when you're indoors, and ways to keep those droplets and aerosols from being there and getting you.
I've seen some studies that show that even asymptomatic people are showing signs of lung damage. And it's possible that there's also organ damage, including kidney damage, heart damage, or brain damage. Is that something we should be concerned about?
Yeah, well, anytime you have a new disease, there's going to be a lot to learn about it. And anytime you have an infection, you have your whole body responding in ways that isn't always obvious to your eye, right? And I think that the easy example that most people are familiar with is something like strep throat. Mm-hmm. So, we used to not necessarily worry about treating strep throat. If you get a sore throat, even if it's from that strep bacteria, it may actually just go away on its own. But what we found is if it wasn't treated aggressively, then your immune system, when it was fighting it off, those antibodies cross-reacted with your heart valves. And so in the long run, we saw people getting heart disease and heart valve problems because of untreated strep infections. So that's one of those examples that I think everyone has had some experience with, where the disease itself led to complications that no one really thought were going to be there. But that immune system, once it's activated, it can start attacking other organs. And we have certainly seen that in late phases of coronavirus, that there are consequences to your immune system having to fight off this virus. And we're only really learning what those are. In kids, we're seeing a multi-system inflammatory response that can be pretty scary. We're hoping that it's rare. It's hard to know that yet because not a lot of time has gone through. We certainly saw early cardiac issues where funny rhythms were happening in people's heart because of the virus. Anytime you have a lung infection, you can have long-term scarring to the lung. And for some, that may be a huge deal just for the virus, but someone has asthma or has had other lung problems, this may be a huge impact on their life overall. So most people don't get severely ill, which is great. And most people do recover. But what that recovery looks like and what the long-term effects are, we know that some of them are going to have chronic problems. Probably most will, but we don't quite know that yet. It's just been too quick.
Are there issues that you'd like to address or bring up?
Keeping yourself safe does not mean not taking care of yourself. If you're having a heart attack, come into the hospital. We don't want to see those secondary consequences, the deaths that occur because of that delayed care.
Well, thank you so much.
Yeah, thank you so much for having me. It's always fun to talk.